Good morning and welcome. I'm Jill Gilbert. I am the co-producer of the Digital Health Summit. Turn off your phones. Started to hear it. We have an incredible day in store for you. As you'll see from the program guide, which you all should have received on your chairs, we have 9 sessions today covering a variety of topics related to digital health. We'll cover everything from remote monitoring of patients to advances in telemedicine, mobile health solutions, options for caregivers, and the latest technologies that can help promote wellness and quality of life. There are even some products that will hold me accountable if I don't eat right or if I skip out on going to the gym. We'll see. We're really leaving nothing unturned here. Our panelists, as you see, are truly the cream of the crop in digital health. It's a rare chance to have so many industry leaders and thinkers from such a wide variety of companies all under one roof. So I encourage you to be a complete sponge. I know I will. Soak up all the ideas and the inspiration you can, and make sure to network with these terrific people here and in the expo downstairs, which again is full of fascinating people and organizations. They are pointing the way to what is now in digital health and what will the future be. So, sorry, let me get the clicker thing. At this point, I want to pay special thanks to our platinum sponsors, Walgreens, Ant Plus, American Express Open, and United Health Group. And each of these groups have great exhibits downstairs, so make sure to go down and visit them and see how they're forging ahead in digital health. I'd also like to thank our gold sponsors, the Bluetooth SIG, Continua Alliance, Ideal Life, and Qualcomm. Again, all have great exhibits downstairs. Definitely make sure to go visit them. I owe a personal thank you to Susan Walker and Robin Raskin, the founders of this summit. They entrusted me this year to help grow this event, and it's been rewarding and fun, and I have learned a ton. I thought I was somewhat knowledgeable about digital health, but honestly, I really had no idea. Every time I spoke to the people that we're going to meet and hear from today, I learned so much more, and I realized how lucky I was to be doing what I'm doing during this time period. The amount of innovation and growth is intense. I honestly can't wait to hear what you all have to say. And it's not just our speakers, all the people in this room as well who have so much to offer. How great is it that we can all get you together here today? It really is a digital health revolution, and I feel really grateful to be a part of it. So, before I introduce you to our keynote speaker this morning, I want to cover a little part of the housekeeping stuff. Kind of put my attendant cap on. So, the basics. Restrooms. Restrooms out and to the left, right past the door. Right past, there's a wired booth, like a wired booth. The restrooms are right out there and to the left. And because you'll have a ton of information and you'll want to swarm all the speakers afterwards, I imagine, I ask you to take the conversations outside. Today is an extremely tight day. We're going to stay on schedule, and we want to give the next panel the opportunity to come up and have their time. So speakers, if you want to network with people and those that are probably going to swarm you, please step outside right after the panel. Second, if you have a smartphone, and I am sure you do because this is CES, please set it to silent during our sessions or turn them off. We're a lot of mobile junkies here, and if you're going to tweet, we would love you to follow it with our hashtag DHS11, Digital Health Summit 11. So, now what's in store for you this morning? I have the distinct honor and privilege of introducing you to our keynote speaker, Colonel Ron Poropatich. He is Deputy Director of the U.S. Army's Telemedicine and Advanced Technology Research Center, or TATRC. As you'll quickly learn, Colonel Poropatich and his team are really blazing a new trail in telemedicine and mobile health, and his particular group of stakeholders, our men and women in uniform, literally are counting on TATRC's work to help save lives now and in the future, both home and abroad. Colonel Poropatich is a medical doctor based at Fort Detrick in Maryland. His group manages over $450 million a year in federally funded research in advanced medical technology. He is a professor of medicine at the Uniformed Services University of the Health Sciences in Bethesda, Maryland, and is the chair of the NATO Telemedicine Expert Team. He is a former president and board member of the American Telemedicine Association and a practicing pulmonary medicine physician at Walter Reed Army Medical Center in Washington. Wow, you're busy. And that's just part of his resume. You're up.
Can you hear me? Am I on my mic live? Yes. Great. Well, good morning, everyone. Jill, thank you very much for that very kind introduction. It's wonderful to be here. I've never been to the Consumer Electronics Show, and to have such a full house so early in the morning speaks to either a great interest in mobile health or the fact that nobody had dinner plans last night and everyone got to bed early. So it's great to see you all. What I'd like to do over the next 45 minutes is talk about mobile health primarily. I can talk telemedicine if you're interested. Maybe I'll do that during the breakout. There's just not enough time to get into both. But suffice it to say, we have a very active telemedicine program in the military, and other telemedicine experts here with us. My colleague Jay Sanders, Jay's here somewhere, past president of the American Telemedicine Association is here, as well as other colleagues from TATRC are here as well, Mark, Ken, and Scott as well. So we've got a great opportunity to share that information with you. The clicker, if I may, Jill. What I'd like to do is walk around as much as possible and just go into my presentation. Let's see, Mike, the one on the left, okay. And then F5, let me get that going. All right, here we go. Well, again, this clicker works. These are my views and not those of the U.S. Army or the Department of Defense. Also, I have no proprietary interest nor promote any particular company or commercial entity. However, I will be talking about our commercial partners who have been very active in helping us with the telemedicine mobile health projects that you're going to be hearing in just a few minutes. Realizing that there's over 6 billion mobile phones now in the world, it's only a matter of time before the mobile platform really becomes the platform of choice for all telemedicine encounters. You know, there's more mobile phones out there than toothbrushes. There are more mobile phones out there than people having access to clean water. And that's really an amazing statistic when you think about it. And so when you look at the U.S. Pervasiveness of cell phones and the worldwide pervasiveness of cell phones, you can see how I think mobile health is going to be the way we're going to be doing telemedicine in the near term. This is a slide that Dr. Topol from University of California, San Diego provided me. And it's an important slide because I think it really brings home an important message as to why we're in for an exciting time. As we've sequenced the human genome, we now have over 100 identities now. We know the genetic sequence of 100 different diseases. So now I can provide you with a medication based, if you have that disease, specifically tailored to your genetic makeup. We've got over 6 billion cell phones, over 2 billion internet users, and now over 550 million Facebook users. And that's just over the last 6 years, they blossomed to 550 million. And so when you look at this convergence of all this digital information, we're in for a major shakeup in healthcare. I love this slide. I'm getting too much use out of it, though. But when we talk about the pervasiveness of cell phones, here's a baby in a maternity ward just texting, "Oh my God, I just got born." And you can see it's only a matter of time. If any of us that have children, I've got a 22 and a 24-year-old, I mean, texting and cell phones, I mean, just walking around the exhibit floor here, you'll see how everyone's walking around with a cell phone in hand, communicating with somebody about something. So how do we use the cell phone in healthcare? How do we do what's called mobile health? I think it's really the mobile health definition. It's using those mobile devices to wirelessly link patients to healthcare providers and populations to deliver services and to promote healthy behavior. That's a message I'm going to highlight again and again. How can cell phones change behavior?